Okay, now we've got a couple people that have written in and asked some questions. One individual's asked if hot water helps kill the virus, or hot water and soap versus room temperature.
So hot water is not the best way to kill the virus. Washing your hands with soap and water, yes, because that's living tissue. And when you clean surfaces using alcohol, using bleach to clean the surfaces, the virus supposedly is very sensitive to that. So you want to use bleach, you want to use alcohol, you want to clean the surfaces, the inert or dead surfaces, and you want to wash your hands with soap and water. Keep your hands away. If you happen to get the virus on your hands, then touching your face is going to be the thing that puts it inside your body. So try to minimize that also.
Okay. Another one is asking, does the virus only affect and hospitalize those with underlying complications or those of an older age?
So when I'm asked, does it only affect the older or the people with multiple chronic conditions or immunocompromised? The answer is no. It affects more than that. And particularly in Dallas, Texas, the first two of the first people who had to be intubated or had to have a tube put down their throat to breathe for them, one was in their 20s and one was in their 30s. So you do not want to get COVID if you can in any way, shape, or form avoid it. A lot of young people are thinking, oh, it's going to be a cold. They're very cavalier. I think that's misguided. You want to avoid getting it. And the stats are, if you're older, it's much worse. So we see terrible things with the lungs and stuff happen more commonly in the elderly, but that is not to say it doesn't happen in young people. I heard the first 2 reports of children dying of COVID-19 over the last 3 days.
I've got another question about people that have recovered. Are they safe to be out and about because they now have immunity? Wondering if a healthcare provider who gets it could, in theory, stay home, recover, and then come back and help treat patients without contracting again, or would he or she be okay to be around their families who might not have contracted it yet?
Okay, when people get COVID-19, they develop antibodies and they get well. Right now, there's still some controversy about can they be reinfected, so that's not completely answered yet. But in general, it's like the flu. Once you get that strain of the flu, you're immune to that strain of the flu. And that's why we immunize people. It's because they build up antibodies to get protected from that strain. So theoretically, once you get the COVID virus and all the symptoms are resolved, you've gone back to normal, you should be safe to go out and be about and around other people without giving them COVID or getting COVID from them. And we're still learning about that, so it's early. I wouldn't be cavalier or brash, but that's what we think happens as of this time.
Okay, another one. This is written in. Let's say my family and I have already contracted the virus back in early February before it was widespread. We had the symptoms, everything to a T, but no positive test. Didn't take a positive test. It was myself and our kids had a fever that ran for 10 to 12 hours out of nowhere. What's the chance if we're exposed again that we will have the same, none, or worse symptoms? Is it less likely we contract it again?
I get the question frequently, if I had a respiratory tract infection, if I had a cold that sounded a lot like COVID and I got well, but I never got tested because there's a shortage of tests. We can't even get tests for people who are not being considered to put in the hospital today in Dallas. Does that mean I'm okay to go outside and to possibly be around people with COVID? And I would answer you no, because you don't know if that's what you had. I've had people who had very strong symptoms that were very suggestive of COVID get tested and it's completely negative. So they did not have COVID, even though you would have sworn they would just clinically. So if you don't know, if you don't have a positive test and then you get well, in that situation you probably can be more confident that you're not going to get sick from this strain of COVID-19 again. But if you had symptoms but didn't get a positive test, I don't think you can be confident that if you were around someone with COVID-19 you wouldn't get sick.
Okay, thank you. Another question, if I have a 3-month-old baby or any other child scheduled for vaccines or doctor visits, should I reschedule?
At this time, we're recommending that you not go to the doctor's office unless there's a problem that you need to be treated for. The routine, elective, meaning not vitally necessary procedures and visits, we're canceling. So I would recommend that if you have young children that were due for immunizations and things, of course, talk to your pediatrician they'll be keeping up to date and they'll have good advice for you. But in general, unless it's medically necessary, we're not doing anything right now. We canceled all of our blood pressure, diabetes, cholesterol patients coming back into the office because we don't want them to be out and exposed to things. Rather, we're managing them by telephone and video medicine right now.
Okay. And if someone needed a primary care physician or is looking to be a patient at your clinic, how would someone schedule an appointment?
So if you're interested in coming to Go Medical, Joy Ackland is our new doctor, and she's taking new patients. Just call 972-292-7158, hit extension 2, and we'll get you set up either for a video visit or to come in and be seen, depending on what the challenges you're dealing with at this time. We are keeping the office open. We're very cautious. We're doing all sorts of sterilization procedures, but we're also seeing patients where it's absolutely necessary. So please let us know if we can serve you, and we'd be happy to make that work.